All right. I want to thank Nancy Rios again from HRSA for driving down here from Kansas City. Nancy is the Region 7 Administrator for HRSA, which means that she covers, I'm going to screw this up, Missouri, Kansas, Nebraska, and Iowa.
Yes.
Is that right?
Yes.
All right. I first met Nancy when she was in Jefferson City several months ago, and I told her, we're thinking about bringing back this conference called the Allied Health Con, and I couldn't even finish the word, and she was like, can I come? Can I speak? Can I meet people? So that was one of the things that Dr. Light and Dr. Williams were really saying that they wanted to bring. They wanted to bring that local perspective. They wanted to bring the statewide perspective in Jill Williams from Missouri Hospital Association, and we wanted the federal perspective as well. So Nancy, we've got you here to talk about grant opportunities. And again, thank you for making the drive down. We really appreciate it.
Thank you for inviting me. So hi, everyone. Good morning. Oh, come on. You've been drinking Diet Coke, so you should have enough caffeine like I do in my system. Good morning. It is an honor to be here with you all today. And I want to really thank Cliff for allowing me to come and share with you some information about the Health Resources and Services Administration, specifically about some workforce programs and resources that you might be interested in. And you are going to see as I talk about those programs that are going to be addressing some of the questions that were presented to the panel. And that's why I figure, okay, I just sit back, enjoy the panel, and then be able to present to you about our programs that address health work shortages and look to increase the workforce. So how many of you are familiar with my agency, the Health Resources and Services Administration? All right. Let me start then by giving just a quick overview of who we are. Federal government, we love our acronyms. So Health Resources and Services Administration, HRSA. We are one of the 11 operating divisions within the Department of Health and Human Services. And at HRSA, we work to improve health outcomes and address health disparities through access to quality services, a skilled health workforce, and innovative high-value programs. We do all this through the operations of more than 90 programs. So you can imagine, the more I put here, the more things come out. So that's why you see that I have notes, more than 90 programs. And what I really like about our agency is we're truly a grant-making agency. We put the dollars in the communities, so the communities then go ahead and design the programs that best meet their needs. So we support these programs to grants and cooperative agreements, to more than 3,000 awardees, including community and faith-based organizations, colleges and universities, hospitals, tribal government, state agencies, and so on. So Carol Johnson joined our agency, that she's our administrator, in January 2021. And the minute she came on board, she said, hey, we got to lay out some priorities for the agency. Those priorities aligned with the department's priorities, and those are mental health, and that's behavioral health, substance use disorder, maternal health, and workforce. So this slide over here shows you our principal program areas, and that includes primary care, HIV/AIDS, maternal and child health, health workforce, healthcare systems, and that's organ donation and transplantation, and rural health. And you might say, well, you only have one area that focuses on workforce, and actually workforce, it's sort of in everything that we do, right? It doesn't matter if we're talking about behavioral health. If we talk about behavioral health and the needs in communities, we're going to be talking about workforce. Same thing with maternal and child health, and you're going to see that as I talk about the different programs that we might have available in fiscal year 2024. This slide shows you our organizational structure. I'm part of the Office of Intergovernmental and External Affairs. So I'm going to just talk briefly about my office. We are the principal agency lead on intergovernmental affairs, external affairs, regional operations, and tribal partnerships. We have 10 regional offices and one sub-office in Puerto Rico, and our headquarters is located in Rockville, Maryland. I'm Region 7, and like Cliff said, I cover Iowa, Missouri, Kansas, and Nebraska. I tell folks that my office, we do the fun stuff. We don't have grants to give you, but we are the folks that go out there and do partnership development. We go out there to educate stakeholders about HRSA programs and resources. We are the ambassadors not only providing outreach and education, but also increasing the reach, impact, and the resources and funding opportunities out there in many communities. So for example, the kind of work that we do, we host grants 101 workshops. Per request of stakeholders, we might put together webinars on a specific topic like maternal health, or it could be about behavioral health, depending what are the requests and the needs of the communities. We also have done community health worker summits and those kind of things. So bottom line, call me. Connect with us. We can help you in many ways, not only brokering relationships with other agencies, federal agencies, as well as non-federal agencies, but we can also help you if you need data for an application. We can help you then figure out where to get that data. We can help you perhaps brainstorm about a funding opportunity that you might be looking at to support a project. We can do all those kind of things. So, or just to say hi, just call me. All right, so HRSA leads the department's efforts to grow and diversify the workforce. And here are just few of those outcomes so far. We have trained more than 24,000 clinicians, and that's the largest number ever. And actually, those 24,000 clinicians have received scholarships and loan repayment in return for practicing in underserved communities through our HRSA's National Health Service Core Program. Over 34,000 individuals from racial and ethnic and economic backgrounds underrepresented in the healthcare workforce are receiving support and training this year through HRSA programs to become healthcare professionals and improve the quality of care delivery in those communities, in those targeted communities. And then approximately 13,000 community health workers who reflect the diversity of the communities they serve will be trained and deployed to expand access to community-based care through a program newly designed and launched by HRSA this year. It's a community health workers training program, and I will talk briefly about that because that's not forecasted for 2024. It was going to take a couple fiscal years before we get there, but I want to celebrate the fact that there is a grantee that's a community college in Missouri that actually has that grant. So HRSA's workforce program train physicians, nurses, paraprofessionals, behavioral health professionals, public health professionals, and we invest in strategies that engage students in health professions early through career development and scholarship programs. We support building career ladders in healthcare and invest in paraprofessionals and professional education as well as training programs. We fund postgraduate and residency training programs as well as loan repayment programs aimed at recruiting and retaining practicing clinicians as faculty. And many of those programs are housed within our Bureau of Health Workforce, and the BHW acronym administer programs that are designed to strengthen the health workforce and connect skilled professionals to rural, urban, and tribal underserved communities nationwide. So it's not only about training the future healthcare professionals, but also making sure that they are serving in those areas where they're most needed. So right now you're getting handouts about these two programs, the National Health Service Core Program and the Nurse Core Program. And these are programs that basically they provide loan and scholarships to eligible professionals. In turn, they commit to serving at what we call an NHC approved site in a health professional shortage area. So there are different levels. There are scholarships, there are loan repayments, there are many disciplines that are covered by these programs. And currently, the program that it's open is called Student to Service Loan Repayment Program. Students in their final year of primary healthcare professions, they're in the last year they're schooling, and that includes nurse practitioners and certified nurse midwives. They're eligible for this program. They may qualify for up to $100,000 in tax-free loan repayment. And again, once they get that assistance or that we help them with their loans, they have to commit to serve at least for 3 years in a high need area. So new this year, it's a maternity care target area supplemental award. That's an additional 40,000. So the student to service loan repayment program is up to $120,000. The maternity care target area supplemental award, it's an additional 40,000. And that is an additional 40,000 to physicians specializing in obstetrics, family medicine, who practice obstetrics on a regular basis, as well as certified nurse midwives. And the reason I'm bringing those programs, if your community colleges say, well, we don't have a certified nurse midwife program, or we don't have a nurse practitioner program, you have bridge programs. I know some of you partner with universities. And so here are incentive to move your students to higher levels of education, to encourage them to continue to pursue higher degrees, moving on to a four-year college to get their nursing degree, perhaps. Also, there is one specific program that I think would be of interest. It's not currently open, but you might want to just keep a pulse on that because your students might be eligible for it. And it's the Substance Use Disorder Treatment and Recovery Loan Repayment Program. That one offers up to $250,000 to substance use disorder professionals and support staff, to include community health workers, peer support specialists, health navigators, and again, in exchange for 3 years of service at a what we call STAR LRP approved facility. So in a facility that is within our list that we know they're providing substance use disorder kind of services. And again, I wanted to, even though this one is not open, would be one that I would just keep an eye on and just make sure your students know about it, because it's one that once they go out and get a job at a STAR approved facility, they can apply for this loan repayment program. So we have great tools to connect clinicians that are these programs with facilities that are looking for healthcare professionals, and that is the Health Workforce Connector tool. It is a place, again, where we connect those qualified physicians or clinicians with and trainees with the facilities, the NHC approved facilities, and clinicians here can find career and training opportunities by location, by discipline, by other criterias. And then also we host virtual job fairs. And the first time I heard about it, I was like, oh my God, virtual job fairs, like really does that work? It does work. Here, facilities get to connect through breakout sessions with those clinicians that are looking for a job at an approved site. So then they can take advantage of our NHC Nurse Corps programs. And if someone gets, for example, a nurse scholarship program or an NHC scholarship program while they're in school, we provide them the support. We help them get placed at an NHC approved facility. So there are also other loans that, other programs that are for schools, directly for schools. So schools then can then offer loans to students in need who pursue a health professions degree. Each loan is a long-term low interest, and students then deliver care to people who lack access to primary healthcare services. And out of those that you see there, the one that I want you to keep an eye on is the Nursing Student Loans Program, because community colleges are eligible for that program. It's a one-year program that you can apply for, will be opening later this year. And your school is eligible if you are offering a diploma degree in nursing, an associate degree, bachelor's degree, and even a graduate degree. But I know with a lot of community college, you get up to the point of an associate degree. And actually, I know of one community college, not in this region, that's taking advantage of this program, and that's Oregon Community College. Okay. Also, another program that I want to highlight is the scholarships for disadvantaged students. And we were talking about, the panel was talking about bringing diversity to the workforce, ensuring that those people that don't have access for higher education because they just don't have the means, that there are ways for us to create the pathways to have programs in place to help them pursue education. So we have this scholarship for disadvantaged students that basically provides funding to the university or the college. And then the university then it's able to offer scholarships to the students that are pursuing healthcare careers. And there's some specific eligible disciplines, but I wanted to bring that up because we were talking about diversity, we were talking about need. And so HRSA, we are very mindful of the need to create a very diverse workforce and reaching out to those that need it the most. All right. And the last thing I want to say about the scholarship for disadvantaged students is that within that program, the schools can not only have the students use the scholarship for paying for tuition, but there's some other allowable costs. So students can get a stipend. And again, going back to the conversation about, some students, they are working students. They can't just stop working to be able to go to school. They have some needs like, health insurance. They might have some needs to have dollars in their pockets to be able to eat. So some of these programs allow for them. Might not allow for housing or childcare, but they can be used for some other things like in the form of stipend that will allow them then to pay for food and some other things that are needed. So talking about the next few programs, these are programs that are forecast. So some of these programs will depend on appropriation, some of them would not. But I want to just highlight a few of them, so then that way you can start thinking about whether this is something that you want to pursue as a community college. And you're going to see me reading some notes because also I went ahead and as I was looking to some of these, I went ahead and tried to look to see if there were any other community colleges that in the past had applied for any of those programs. So I'm going to be talking about some community colleges that are already receiving this kind of fund and talk to you a little bit about what they're doing so you can get ideas. And my goal will be also that at some point, if you're interested in learning more about any of these programs, that you reach out and perhaps we can have a call with some of those past grantees of these programs that are community colleges so you can learn more about how they're doing it. And, there's no use of replicating the wheel, right? It's better, it's just go ahead, still good work. That's why we have grantee directories out there. I'm going to talk to you also about where you can find our grantee directories for the Federal Office of Rural Health Policy. Again, because we want you to see what's being funded in the past, take ideas, and then move forward implementing what really makes sense to your community. So the first one is this supporting the mental health among the health professionals. And this is a new program, so there's not a lot I can provide besides the purpose of the program and then the expected number of awards. The purpose of the program is to support healthcare entities, including entities that provide healthcare services such as hospital, community health centers, rural health clinics, or medical professional associations to promote wellness, resiliency, and mental health of the healthcare professional workforce using established or enhanced evidence-based or evidence-informed programs to transform organizational structure. So basically, this is a program that is for you to build a curriculum to support the mental health among health professionals. It's for you to then develop the educational piece to do the education. The estimated post date, according to grants.gov, is December 4th of this year. However, I won't hold us to that date. What I do know is that estimated project start date will be July 1st of 2024. The next one that I want to spend some time talking about is the Behavioral Health Workforce Education and Training Program for Paraprofessionals. This one will be posted according to grants.gov November 27th with an application due date of January 29th. Again, those are dates that are out there. I won't hold my breath, but I will tell you the estimated project start date is July 1st. You will get a copy of the PowerPoint, so you will have the links to the grants.gov page where you can sign up in grants.gov and get an alert once these funding opportunities open. So the purpose of the behavioral health workforce education and training program is to increase the supply of behavioral health paraprofessionals trained to work with children, adolescent, and transitional age youth at risk for behavioral health disorders by engaging and retaining families in mental health prevention and intervention programs. I will encourage you to look at previous notice of funding opportunity, because even though you might have a new funding coming in FY24, the basic requirements remain the same from period of performance to period of performance. So you can start preparing for the next round. And so in the previous notice of funding opportunity to the program, current grantees were required to develop and expand community-based experiential training to increase the supply of students preparing to become peer support specialists and other health-related paraprofessionals. So the program have multiple objectives, but there are two objectives that I do want to highlight because it goes back to what the panel was asked about using telehealth, and also about, again, supporting those students within those areas that they needed the most. So in terms of this program, the one objective is to promote technology integration in the provision of peer support specialists and other behavioral health related paraprofessional services and training programs, including utilizing telehealth services, implementing strategies to increase digital health literacy, and offering options for distance learning. And actually, if you look at a lot of our grants, there's always that piece of encouraging people to think about how to use technology to either increase access to care, offer a health service, or continue to produce or continue to conduct training, distance learning, and support professionals that are located in rural areas. So we truly believe that telehealth, it's a key for many underserved communities in terms of getting the access to care that they need, and also for training additional professionals. We actually have an office called the Office for the Advancement of Telehealth, OAT, and one of their main functions is to promote the use of telehealth, to put their funding to look at evidence-based models and support evidence-based models to provide care using technology. So we are very much support of the use of technology, telehealth as a modality to not only provide care, but also train the future workforce. So the fiscal year 2021 funding, applicants were able to request up to $350,000 per year for programs only implementing what they call the level 1, which was just basically training, okay? And then up to $500,000 for programs that were implementing a level 1 and a level 2. Level 1, it was just the didactic, basic program. Level 2 was just what was going to take those professionals to the next level. That's just actually engaging in or being part of apprenticeship programs. And so in Missouri, we had a grantee in the past. It was Metropolitan Community College, and they had a project called Scholarship for Paraprofessional. And that specific project was basically, they used the funds to provide scholarships to their students to get them from community health workers to sort of a behavioral health professional. And I call sort of because they didn't have quite a certification in behavioral health professional. They just went ahead and creating a curriculum to enhance the education of those community health workers so that they had the skills needed to just do some behavioral health work, focusing also on children and adolescents and those transitional age. I also mentioned that I had another objective of this program that I wanted to highlight, and that was the reduced financial barriers for peer support specialists and other behavioral health related paraprofessionals by providing financial support to trainees in the form of tuition fees, stipends, and supplies. So again, that's one of the things that the Metropolitan Community College was doing, is using those dollars to support those students, those community health workers, by helping them with tuitions, with supplies, and providing them a stipend. This is another one that I think also you should pay close attention to, is the Opioid Impacted Family Support Program. And the purpose of the program is support training programs that enhance and expand paraprofessionals' knowledge, skills, and expertise, and to increase the number of peer support specialists and other behavioral health related paraprofessionals who work on integrated interprofessional teams in providing services to children whose parents are impacted by opioid use disorder and other substance use disorders and their family members. So this one, we estimate that we would be posting that announcement sometime in December. Again, question mark, with an application due date of March 11, 2024. And I can tell you that we try really hard to give our stakeholders enough time to prepare their applications. We try to just stick to that 90-day, but sometimes we're not that successful. In the estimated project start date is September 1st, 2024. Award ceiling $600,000, number of expected awards 28. Okay, past funded project, Malcolm X College. I didn't find any past funded projects here in Missouri, so I'm going to just talk to you about some that were funded somewhere else. And again, I focus on community colleges. So Malcolm X College got this award in the past. And their primary objective of their project was to deliver specialized CHW curriculum for 168 students for the CHW credential in preparation to work as behavioral health paraprofessionals. Okay. Also, Community College of Baltimore County received that award in the past. And in their case, they went ahead and actually developed a behavioral health trainee program. Their goal was to train and place 113 individuals, paraprofessionals, to work within medically underserved areas, with paraprofessionals specializing in counseling children and families who experience and or have family members experiencing substance use disorder. They were trained in telehealth as well. So if you look at their abstract, they actually spell out that they were going to train these paraprofessionals in telehealth. And so then out of those 113, once they complete that level 1, they were encouraged to pursue that level 2. And out of that, the goal was to only do 50%, but I don't know where they at. So it'll be interesting to see where they at right now. And the idea was to get them to the level that they became certified, supervised counselor, alcohol and drug counselors, certified supervised counselors. So again, these are projects, again, community colleges have done that could be replicated based on what is your interest. And I'll be more than happy to facilitate a call with those grantees. I also mentioned the community health worker and health support worker training program when I was talking to you about the outcomes of HRSA in terms of our work and workforce. And St. Louis, Junior College District of St. Louis have that grant currently. So they are working on training community health workers in the St. Louis area. We also know that in the past, St. Louis Community College was awarded an opioid workforce expansion. However, that one is not forecasted. So I'm trying to focus on the one that have been forecasted. All right. Federal Office of Rural Health Policy, F4HP, that's another one of our bureaus, and they focus on rural health. They administer grant programs designed to build the healthcare capacity at both the local and state levels. And so I'm going to just highlight one program, and it's this Rural Health Network Development Planning Grant, which is a 1-year grant program that it's to assist in the development of integrated healthcare network, specifically where participants do not have a formal history on working together. And even though this focus more on delivery of care, I've seen lead applicants that are healthcare systems bringing in community colleges to be part of this planning grant, because it's truly a planning grant. It's an opportunity for organizations that are thinking about a project and they need to just kind of formalize their network to then have this funding to actually work on building and a consortium, a formal network that would allow them to pursue future funding opportunity and then move on to implementation of a project. So again, just thinking outside the box, where you can go with this type of funding and who can be out there that can partner with you to create this formalized network. We have funded projects related to telehealth, remote patient monitoring, HIT, you name it. I was trying to see, we have funded something specific to health workforce with that role development, but I couldn't find anything. Doesn't mean that it's not out there. I'm going to keep searching for it. So, but I want to make sure that you guys were aware of it. For those kind of programs within the Federal Office of Rural Health Policy, eligible applicants include profits and non-for-profit entities, institutions of higher education, community-based organizations, faith-based, and they can be in a metro or a rural setting, the lead applicant. But the key here is that the services have to be provided in a rural designated area by HRSA. So where do you find out whether you are eligible for a rural health program? That is going to our rural health grants eligibility analyzer in our data warehouse .gov spot. All right. So we also have workforce programs within our Maternal Child Health Bureau. And again, when I was showing you all those priority areas, all those focus areas or program areas of HRSA, I mentioned to you that workforce was everywhere, right? And so within MCHB, we invest in strengthening public health capacity in addressing the needs and challenges of the MCH workforce. They have within the Maternal Child Bureau programs that are to train the future leadership in the maternal health area. It's also training to support those individuals, those that are in the maternal health field. So I'm not going to spend a lot of time kind of just showing you all the resources, but there are plenty of resources out there that are educational pieces that people can use to do some education about maternal and child health. So the opportunity that I want to highlight is this Growing and Diversifying the Doula Workforce Program Community Awards. And this is a brand new program. The purpose of the program is to directly fund community-based organizations, CBOs, to recruit, hire, and train a diverse and sustainable doula workforce in areas most affected by adverse infant and maternal health outcomes. And you might say, well, this is community-based organizations. Well, community-based organizations have to partner with folks that can provide the training. So here's where you come. So that's why I say, pay attention to this one. This might be one that you might want to think about in terms of creating a partnership and then moving forward, putting a project together to do the training for doulas, because we know that maternal health is a big issue in rural communities. We know doctors or hospitals are closing the OBGYNs and their labor and delivery rooms. And so what are we going to do? And the idea is just then to create or to train those professionals that can assist women in those communities. So where you can find our funding opportunities, 2 sites, HRSA.gov and grants.gov. And you can, if you go to grants.gov, as you probably know, you can put an alert and then know the minute those opportunities open, you can get an email letting you know that it's ready to go. And if there are any changes to that funding opportunity, you also will get an alert that there was a change on that funding opportunity. At HRSA, we also have a technical assistant grant page. And there are just lots of resources there from what we call the SF 424A, which is a compendium that you should use with the notice of funding opportunity, to actually links to training that happened in the past, and also the link to, the recordings to our Healthy Grants workshop. So I encourage you just to take a look at those resources. In terms of telehealth, the Office of Advancement for Telehealth or for the advancement of telehealth. They are the ones that run the telehealth.hhs.gov. And the reason I would like to bring those one up is as you're thinking about your own curriculums and wanting to just educate your students about telehealth, this is a place that you can go because they do have lots of resources, not only for patients, but also for providers. If you are one that thinking about implementing a program, this is a place also to go. And also what I like is that there is a place there that you can find information about funding opportunities to support many programs or many projects. And then we have the telehealth resource centers. We fund those. And what I like about the telehealth resource centers is that they can provide up to 10 hours of free consultation. So if you have a provider, an organization that's thinking about telehealth, whether it could be a distance learning, you can just give them a call. There are 12 regional telehealth resource centers and 2 national. The national, it's the Center for Connected Health Policy. They focus again on policy. They keep track of what's happening in the telehealth field, what kind of legislations are out there, not only at the federal level, but also at the state level. And then one in technology. So if you need help trying to figure it out, what technology do I need in order to implement X, Y, or Z specialized program, telehealth program, they can help you identify that technology. But again, they can help from building a business case for telehealth to actually putting standard operating procedures together to actually doing training for community health workers on how to be a telepresenter, for example. And then we have the Rural Health Information Hub, which is our national clearinghouse on rural health information. And there are so many things here that you can get out of the Rural Health Information Hub. I mentioned before that we have grantee directories. This is where you will go and get our grantee and source directory. So if you want to see what projects have been funded in the past, this is a great place for you to go. You go in the search and just write FORHP grantee directory and you'll see it. And you will see it by different categories. You'll see grantee directories for the Rural Health Development Planning Grant. You'll see a directory for the Rural Community Opioid Response Programs, and you go on and on and on. Also, they have lots of information or toolkits. And if you're looking for evidence-based models, this is a place to go. If you're looking for a tool that helps you with economic impact or return on investment, you can find one here. And also, if you're located in a rural area, you needing to locate data, need to identify a funding opportunity to support a project, you can give them a call and they will be able to provide you free customizable assistance by giving them a call or just by emailing them. And that's one of the things that I like so much about our agency. We not only provide the funds for grantees, for organizations to implement projects, but we also fund technical assistance centers to support those grantees to make sure that they're successful. So all these resources are for grantees, but also for anyone that needs to use those resources. So it's open to anyone and everyone that might need them. So the HRSA Data Warehouse is a place that you can look up how much HRSA is funding in your state. If you want to see the penetration of our programs to the county level, you can do that. And this is great because you can also transfer data from other resources and create maps to support your grant applications. And if you're ever wanting to just get a demo on how to use this site, just give me a call. We can definitely get a demo for you on how to utilize the site. But if you go also under tools on that page there, if you want to see who's being funded by programs, remember that I was giving you examples. There is on the find grants, you can just do an advanced filters, select the program that you want to see, select the fiscal year, and then it will give you the list of all the grantees for that specific program for that fiscal year. And the beauty of it is that in a lot of cases, I would say 90% of the cases, you'll be able to click and see the abstract for that program with the name of the individual and the point of their contact information. So you can give them a call and engage in a conversation about, hey, can you talk to me about the project or just, for your purpose. We also have the health workforce projections dashboard. It was done by our National Center for Health Workforce Analysis, and they develop research reports that focus on issues that affect the U.S. health workforce. And so this is important because it allows us to then think about where we need to focus our efforts, right? Where are the gaps in terms of healthcare? So right now, the health workforce projections dashboard can give you a sense of how changes in population will affect future workforce demand across 6 healthcare fields. And those are allied health, behavioral health, long-term care, oral health, primary care, and women's health. So you can do actually see it overall, but also you can just drill down to your state. And so here, I just gave you a screenshot for the state of Missouri, specifically projections for all health workforce based on the population, the adequacy that you'll have in the state by, I think this is like 2030, I believe. And again, this is something that if you're interested in learning more, we can definitely coordinate a session for you to just see it. Public health training centers, I wanted to just highlight them because they do have really cool resources. Our regional public health training center is the Midwest Training Center, and I put an arrow there. And they basically put together programs to support public health professionals. They do podcasts to connect public health professionals and discuss different topics that include, COVID-19, for example, leadership development, those kind of things. And they also offer internship throughout the region. And in fact, the University of Nebraska, it's one of the main grantees from us that support the Public Health Training Center, the Midwest Public Health Training Center, and they're offering a scholarship, and I got to look at this up. That scholarship, it's for individuals that live in rural, underserved communities in Nebraska, Iowa, Missouri, and Kansas. And it is a public health expansion scholarship. Individuals that are accepted into the program, they get full tuition and fees, and they're actually looking to support at least 37 students, up to 37 students every year. The scholarships are awarded right now. Well, the first round was awarded in spring 2023. Next round will be awarded fall 2023. And the individual just have to be then admitted in a public health program with the University of Nebraska. And they're actually paying from certificate level all the way to PhD. So this is something that we want to put out there because it's all online. And so if you might have someone in Missouri that's interested in public health and they can find scholarships to further their education, here's a program that they can take advantage of. Then I know that a lot of kids that are in community colleges, sometimes they just can't afford health insurance. Well, you're probably aware of our community health centers that they can provide free care or in sliding fee scale to individuals that are uninsured, underinsured. So this is a great resource for your students to send them to get healthcare, quality healthcare, because what the health centers provide, it's comprehensive from primary care to behavioral health to dental and so on. There are widgets that we can give you for you to put out there in your website. So I'll be more than happy to share those with you. And then we also have a locator for Ryan White providers, HIV providers. And I don't know how many of you are familiar with the Ryan White program, but it's really a comprehensive program that helps people living with HIV pay for their medication, pay for healthcare if they are underinsured or they are not insured at all. Then I want to put a plug for the National Maternal Mental Health Hotline. I don't know how many of you have heard about it, but it's a line that provides counseling, or not counseling, support services. I want to call it right, support services 24/7 to pregnant women and their families and the loved ones. The line, it's open 24/7, 365 days a week. And we have many languages available for individuals that call. And we have trained counselors actually picking up those lines, and they can actually do referrals to local services. So that we ask you that help us promote, because you probably have pregnant women in your community colleges, and this is a line that can really help them. It's not a crisis line. If someone has a crisis, then if they're calling the line, they are transferred to 988, or they're transferred to the National Domestic Violence line, depending on what their needs are. So it's a great thing because they don't have to hang up and then call another number. They can just go here. But again, this is a great place if someone is going through if someone is dealing with a situation, they need just support, they need a referral, they can start here, crisis 988. There's also a partner toolkit if you need to have more information about the program, if you want to promote it with a slide. Also, you can order materials free of charge. It includes some cards. They look like business cards, posters, magnets. You can order them, and again, free of charge to you. And then lastly, there are some reports and tools that I wanted to just highlight. There's one that I will encourage you to take a look at it. It's the one that's highlighted, was put together by the National Conference of State Legislators, leveraging career pathway programs. And so the report actually highlights some of the successful programs available, career pathway programs available, from programs that start from K to 12, programs that link then those kids are in 12th grade to community colleges, and then the programs that link those that are in community colleges to universities to pursue undergrad degrees. And with that, that's all I have. Questions? I know it's a lot. Questions or comments? Yes. Mm-hmm. So some of the grants depend on the cycle, right? So that's why if you want to look at forecast, you're better going to grants.gov to look at the forecast. We are the ones that populate the grants.gov with that forecast. On our website, you're not going to see forecast. You're going to see past funding opportunities, and I encourage you to go there because that's where you can look at past notice of funding opportunities and start preparing for the next cycle. Great question. Thank you. Yes.
And so I'm curious, the reference to paraprofessionals and with regards to behavioral health and SUD, can you explain that a little bit more and what individuals qualify for that?
So for the, so remember the National Health Service Corps program and the Nurse Corps program, those are programs for the individual. The rest of the programs that I spoke about are for organizations to apply for to then implement those programs. So in terms of the substance use disorder for the paraprofessional one, they just have to have a loan from an accredited organization. And then as long as they are then doing behavioral health work at one of our STAR LRP approved facilities, then they can get help paying for that loan. Okay, but it's after they complete. So the loan happens after they complete their degree, and then they find a place where they are working. That is what we call a STAR LRP approved facility. And then at that point, because they are at the site, then they can go ahead and apply for that loan program. Any other questions? All right, thank you.